Well, there's an explosive popularity, especially at Halloween, in the use of cosmetic contact lenses. Last week, we told you about the U.S. government cracking down on dangerous Halloween contacts sold without prescriptions. Now, several large contact lens manufacturers have cautioned patients in the use of those lenses. Here to discuss healthy contact lens wear is Dr. Brent Reed of Griffin and Reed Eyecare. Dr. Reed, nice to have you here.
Thanks, Walt. It's good to be here.
Have you seen an increase in the colored or eye-altering contacts?
Yeah, actually, we've had dozens of phone calls because our practice does contact lens fitting. For people who are interested in obtaining contact lenses for Halloween costume-like purposes or parties, and they're becoming increasingly popular.
I remember maybe 10, 12 years ago, it seemed to be the latest rage. People, with green eyes would become blue, and I haven't seen it that much more.
It's still there, and that's still a large part of the contact lens practice when people do that. But these are a little bit different in the sense that they have all these wild designs. Some of them even have NFL logos, and you can pretty much design whatever you want on the front of your contact lens now.
Interesting. What about the Halloween lenses? Are they much more dangerous than the normal ones?
No, not really. Inherently, they're not. But the problem is this, that unfortunately, somehow these lenses were made available to the general public without even having been examined by a doctor or having a competent exam. And as a result, patients can actually get the lenses. They can obtain them at a flea market, or a beach shop, or over-the-counter convenience store, and then they put the lenses in. And there was a recent report of a young lady, a 15-year-old in Ohio, who developed a massive infection overnight after first using the lens and actually lost the sight in her eye and will need a corneal transplant.
I would think if you're ordering them via the mail system, you're not sure if they fit correctly, and certainly they may not be sterile.
Exactly. That's some of the problem. The other problem is most of the people that use them in that regard oftentimes don't know how to insert and remove contact lenses, nor do they actually have the right diameter so they fit the eye properly. They cause an oxygen debt to the cornea, which then predisposes to an infection. And there is an infectious organism, Walt, that actually will penetrate your eye within 24 hours, actually perforate the eye and cause the contents to leak out. Now that sounds horrible, but it actually happens.
So there is a worst case scenario from even wearing them for a couple of hours.
Absolutely.
Interesting. What about people who want to get general contact lenses, and what's the right way to do this?
My feeling is if you want to wear these lenses or if you want to wear contact lenses properly, you need to see someone who's going to be willing to spend the time to fit you so that the right diameter and base curve and all those parameters are met, and then instruct you into how to care and keep the lenses so that your risk of infection and sight loss complications are minimized.
So could you go to an actual eye doctor and say, I want to wear lenses on Halloween, can you help me get these?
Sure.
I mean, it's a longer process, but the right way to do it.
Sure, and that's the right way to do it. Absolutely.
Okay. Doctor, we thank you, as always.